Hi, my name is Brandy Brown, and I never imagined that at 40 years old I would be a cancer patient, but that's exactly how I spent my 40th birthday in a hospital at a cancer center. The severe pain I had been experiencing since high school took decades of doctor's appointments to get a diagnosis of what was really going on. Several doctors told me I was fine, that there was no cause for the pain that I was experiencing. And for years, I struggled to get and keep insurance so that I could get a good physician so I wasn't having to go to emergency rooms and ERs. But as a result of so many visits and complaints about my pain, my medical record really began to look like the boy who cried wolf. I apologize. But after multiple visits to the hospital, I was finally given a CT scan after all the years of complaining, and it did show a huge mass in my abdomen. I was rushed to the cancer center and diagnosed with a rare cancer called leiomyosarcoma. It was a huge mass, and this type of cancer affects muscle, soft tissue, bones. Basically, it can come up anywhere in your body. And that's kind of scary, especially if you have pain. And there's many people suffering with similar issues. They have pain and they go to their doctors and they feel like they're really not getting anywhere or getting the medical attention that they need, and they're not getting anything resolved. And I remember that feeling so much. I know that they feel hopeless, judged, and depressed. And when you ask Google how long it takes to get a cancer diagnosis, it will mention 2 to 10 days, according to cancer.net. Uh, I understand that's from the time of the biopsy, but in comparison, 2 to 10 days really took me 2 to 10 years to get that diagnosis in my case. And there's a really bad stigma, more than ever now before, about people like doctor shopping and pill hunting. People are going to the doctor with fake illnesses in hopes of getting some type of medication. There's been a rise in cases due to the opioid crisis. And I feel like this was my major hangup when it came to my situation. I was constantly going to the doctor. I was constantly complaining about pain. They would push on my stomach, tell me everything was fine, and send me on my way. And I talked to many cancer patients during my time at the cancer centers, and we've shared our stories with one another. And one of the things that we have in common is usually that it took a long time to get a diagnosis. That, it took several years of them complaining about their symptoms to their doctors to get a scan. And even though I was diagnosed with cancer, it was a little bit of a relief because there was a good reason why I was having pain in my abdomen. I was not crazy, I was not making it up, and I was not trying to get opioids. However, I was angry. I was mad. I was mad because maybe they could have found it sooner and my results would be different. Maybe they could have done more for me. I was mad because our healthcare system is stigmatizing people and making it very hard for people who have serious conditions to break through, to because it seems like everyone has their guard up about this opioid crisis now. It's like a totally different healthcare system. So if you feel something, say something. I've learned that you have to advocate for yourself if you want some results. The doctor who diagnosed my cancer in 2017 actually began to stigmatize me. I would go to my 6 months checkups, and they would ask if everything was okay, if I had any pain. And I started mentioning to her that I was having pain in my right calf muscle and that I would get cramps like a Charlie horse. And they were frequent, often, and without merit. It wasn't because I ran a race or anything like that. So I was concerned. She would rub her hand over my calf muscle and say, that doesn't seem to be cancer because cancer spreads north, not south. And she treated me as if I was looking for opioids because I was coming off of them due to a previous procedure, which caused me to have withdrawal symptoms. I was frustrated and I felt like I was going through this game all over again. I was scared that it really could be cancer and it was going to take forever to get someone who would take it seriously for me. So I researched and found a specialist that actually handles my type of cancer. Luckily, uh, he is in maybe like the top 5 of doctors for this disease, and luckily he's in North Carolina at a great cancer center that I attend now. And um, I started by telling him my experience about taking so long to get a diagnosis and that I was in a lot of pain and I wanted to rule out cancer. The doctor ordered a CT scan of both my legs, and it was bad. There were masses in actually both legs, which was surprising because I wasn't having really much pain in my left leg. And I was really appreciative that he checked both my legs instead of just one because the other one wasn't hurting and I would have never known. And actually, the one on the left is bigger than the one on the right, but the one on the right causes more pain. But when they were talking to me about these tumors, I met with orthopedic surgeon, and he said that trying to do a surgery to remove these tumors would be morbid, and I would not be able to walk again, and I'd be in a wheelchair for the rest of my life. So I had to make a decision if I wanted to do surgery in a wheelchair for the rest of my life, or if I wanted to try radiation and chemo to see if we could shrink the tumors over time. The doctors really suggested radiation chemo again because that is morbid to remove tumors and lose functionality and have to be dependent on someone. And I'm glad that the doctors listened to me and found it. I did complete that radiation and chemo, and the tumors are still there, but they're not getting any bigger. And later on, after being with this doctor for about a year, I mentioned to him that I was having pain in my thigh. And my new doctor, right away, he got me in for a scan to see if it was cancer or not. They did find a mass, they did a biopsy, and they determined that it was also leiomyosarcoma. And if you ever have pain that doesn't go away, or you feel like your doctor's not listening to you, please demand a scan or find a doctor that will listen to you. We know our bodies more than anyone else, even a doctor. So if something doesn't feel right, listen to your body and get tested. Now, when I tell my doctors something doesn't feel right, they listen to me right away. And I just want to thank you very much for listening to my speech today. And I would like to see if there's any questions that I might be able to answer for you.